Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to this edition of what we call Medicare Monday, where every Monday, 5 o'clock Central Time, we look at some of the essential parts of Medicare, the essential decisions that people have to make, and really try to get into some of the really important details, kind of get into the weeds to make sure that these topics are well understood and that really understand how important it is to make Medicare decisions. Of course, the name of our company, MedicareSchool.com, says it all, that we begin our relationship with our clients with an education. We are Medicare brokers. We serve people in all 50 states, all over the country. We write all types of plans, those that would be involved with Medicare coverage, but also help people with their Social Security decisions and investments as well. So we are a retirement firm. We love doing what we do, and I hope that this session tonight will be helpful. And then in the future, we have lots of live events for you. And then, of course, if you've never been to our website, you have some great tools there, especially a workshop that I shoot every year. It's 50 minutes. And if you're brand new to Medicare, I think you'd find that workshop very helpful. Our website's MedicareSchool.com. And it's really, we kind of go through all the different aspects of Medicare, the ins and outs of how A, B, and C, and D work. And so if you're unfamiliar with that, would like to know more, a great place to go. 50 minutes. It's packed full of great information. And then our YouTube channel, of course, we have 400 plus videos that are available to you to learn everything about Medicare and Social Security. All right, so that's us. If you've never joined our Facebook group, please do. If you're not a subscriber to our channel, we'd love to have you be a part of that as well. All right, we're going to get started this evening. I'm going to spend a few minutes talking about this most crucial factor about your Medicare decisions. And then after this, folks, I'm going to take your questions live tonight. A lot of times with this session, you just have an opportunity to put it in the chat, and then our staff responds, but I asked our producer tonight if I could just respond to those questions. I know we're in a very busy season of the year, and so we thought this would be a good format for you to get your questions answered. Okay, so let's get started. The most crucial factor to consider. Now, before I tell you what I think is the most crucial factor, let me tell you what some people think. And some people think the most crucial factor would be what it's going to cost them for their premiums on a monthly basis. Now, I think premiums are important for sure, but premiums are not everything. Premiums matter. We need to live within our means, but for sure, to me, that's not the most crucial factor. I think we have to bring the premiums and the cost and all that, of course, into the equation. But again, I don't think it's the most important factor whatsoever. And so let's talk about, at least my opinion, what is the most important, and that would be how is your insurance going to work? And mainly, how is your insurance going to work when you need it? And folks, I think all of you are old enough to know that you get what you pay for, and you never know how good something is until you really need it. And that's the way it is with all insurance. A few years ago, my son was in a terrible, well, one of my sons, I have 7 children, 4 girls, 3 boys, and my second born son was in a very, very bad car accident. A man pulled out in front of him, sadly on purpose, attempting to commit suicide. Anyways, my son hit him, and the gentleman did pass away, very, very sad. But my son rolled and flipped his truck in just a terrible accident. And I had great insurance, and I was so glad that I did, because it was a mess for sure. But fortunately, insurance was there, and sad, of course, circumstances for sure, but it could have been a lot worse had I not had insurance. So the point is, you never know how good your insurance is until you need it. And so when it comes to health insurance, it's the same thing. And so when I talk about knowing how your insurance is going to work, there are ways that you can find some of these aspects out. How will it work if you get cancer? And so what really matters? And so the first issue with looking at the type of policy you have, the kind of quality you have, is to begin with talking just simply about providers. Where can you go? What doctors can you see? What hospitals can you go to? And so when it comes to providers and Medicare, you got to realize there's really only 2 options. If you stay in the original Medicare system and get a supplemental plan, you actually can go anywhere you want as long as that provider takes Medicare. Let me say it again. If you stay in original Medicare and get a supplemental plan, you can go to any provider as long as they take Medicare A and B. Now, statistically, here's what we know about providers. We know that 100% of all hospitals take Medicare, 100%. And we know that 99% of all non-pediatric doctors take Medicare, 99%. Of course, pediatricians don't need to take Medicare. They're working on children, take care of children's needs. But those that are not pediatric doctors, 99% of them will take original Medicare. And so if you stay in that system, you can almost go anywhere you want. It's truly almost unlimited. Now, there are some concierge docs that do not take Medicare. You'll find that there's about 50% of all psychiatrists do not take Medicare. So there's certainly some that will, but again, statistically 1%. So when I talk about knowing how your insurance is going to work, that's the first aspect. Where can you go? Who will take your insurance? So what happens, the other side of the Medicare equation, if you decide not to stay in original Medicare and get a supplemental plan, you're going to have an Advantage plan. And Advantage plans are by far not bad insurance, but they work differently. Advantage plans are a private health insurance company that is replacing Medicare for you. And so the first thing they have to do to even make an Advantage plan possible is to put together a network of providers. Those insurance companies have to have some way to control their costs, to be able to budget for aspects for providers. And so they have to know how much it's going to cost them to for someone to go to the hospital or to see a doctor or to have a surgery or to see a specialist. So they have to pre-negotiate prices with providers that will agree to accept their terms and their patients. And that's called a network. And we have two types of networks, HMOs and PPOs. As we move into 2026, we're seeing more and more HMO plans being available because it is a way that the insurance companies have a little bit more control over their profit margins. The PPO plans through the years have just proven not to be very profitable. And so today you have to decide if you take an Advantage plan, what plan do you want to be on? What are your providers covered? And sadly, what happens is that a provider may take your Advantage plan this year, not next year, or the hospital says, no, we're no longer going to take that. I had a call with a lady today that called in from Kentucky, and she actually runs a hospital, and she told me they honestly despise Advantage plans. They've just had such bad experience with them, low pay, slow pay, fighting on pre-authorizations and those kinds of things. And so she said it's very frustrating, and people don't realize it until they get into it, and then sometimes it's too late. And so number one, when we look at how is our insurance going to work, which is the priority, you've got to deal with this whole issue of providers. And so what happens if you're on an HMO plan, typically you have to stay in your network. Unless it's an urgent care or an emergency situation, you can't go out of your network. Now, on a PPO, you can go out, but it costs about twice as much to do so. So sometimes people can go out of the network. They have the right to do it on a PPO plan, but they can't afford to do it. And so that's an issue. Now, this year in 2026, we're seeing a lot more what are called HMO POS plans. HMO POS. So it's an HMO network with the point of service privilege to go out somewhere else, but that provider has to agree to take the plan and the terms of the plan. So just because you have the right to do it doesn't mean the provider you'd like to see on a network is going to agree to accept the terms of the plan. And all I'm trying to say is that look at the available providers. And so statistically, here's what you typically are going to see. About the best network with an Advantage plan, you're going to have about 70% of the doctors in that region, in that city, in that area, that will take the Advantage plan, about 70% of them. And that happens, folks, about 25% of the time. Meaning you have about a 25% chance that you're going to be able to see 70% of the doctors in the network. You have about a 50% chance that you're only going to be able to see about a third of all the doctors that are in your region. And still, that could be a lot of docs, and doesn't mean you can't find someone to take the plan. But there is definitely less choices, less flexibility, more restrictions with Advantage plans. So what's the number one issue? You have to know how your insurance is going to work. That's the most important thing, and providers have a lot to do with that. The second issue has to do with who has the final say-so. Who's going to make the final decision whether you get a knee replacement or a hip replacement, or you get to say in a skilled nursing stay, for X amount of days, or that you get that MRI or that CAT scan? And again, we only have two systems. Original Medicare A and B has a few pre-authorizations for sure, few, I think less than 30. But in order, if you're on an Advantage plan, it's hundreds of them, because 27% of the services needed on the Advantage plan have to be pre-approved by the insurance company. Now, they will approve many things, but they don't always approve. And so what happens, people sometimes will get their care delayed. I've had plenty of times when people needed a knee replacement, and the Advantage company said, no, we want you to go to therapy first. In other words, there's some requirements they're going to put upon you before they'll cover a service. Sometimes they just flat deny it. I've had several times when I had somebody that needed a full hip replacement. Insurance company said, no, we'll pay for a rod only. We're not going to pay for a full hip. They just don't want to spend that money. And so again, insurance company overrides what the doctor says you need, but again, they control the purse, so that's all you get. And so you have to know about pre-authorizations. As I said, Medicare has some, for sure. Right now, there's about 12 different procedures. They're going to add 17 for 6 states going into next year, but still, 30 versus hundreds and hundreds on the Medicare Advantage side. And what happens, though, with the supplemental company, they never can put a pre-authorization on you. If Medicare covers, they have to cover, no questions asked. So you'll never have a supplemental plan interfere, delay, or deny any kind of coverage at all. If Medicare covers, they absolutely will cover. All right. And so, again, that's asking yourself, how do I want my insurance to work? Do I want my doctor to have the final say so, or do I want some insurance to be able to run interference if they choose to do that for financial reasons? And then lastly, I want to talk about the policy type, because with supplemental plans, they're permanent. Permanent. So when someone gets a supplemental plan and it's written, then they can never lose that coverage unless they don't pay the premium. So as long as you pay your premium, that's your policy for life. I don't care if you live to be 120. I hope you never are real sick, but if you were, they can't cancel your supplemental plan because of claims. Now, that can happen on auto insurance and homeowners insurance, but not on supplemental plans. They have to pay the claims. So they can't cancel because of age, because of claims, or because you move. You move from one part of the country to the other. Take your supplemental plan with you. That coverage is yours for life. It's truly a permanent, portable policy. When it comes to Advantage plans, they're not permanent at all. They're 1 year at a time. We're in that season now where people are seeing their plans terminated. 2 million plans terminated this year. Plans decreasing benefits, plans changing where they're not quite as attractive as they once were when it comes to some of the benefits of dental and vision and hearing aids and those kinds of things. Those are decreasing really drastically this year. And so, because why? They're 1 year plan. The government allows Medicare Advantage companies to set the terms on an annual basis. They're not lifetime, they're annual, and you certainly don't take them with you. You move from one side of the state to the other. I live in Kansas City. Our office is actually in Kansas, but I live in Kansas City, Missouri. If I moved to St. Louis, just across the state, I couldn't take an Advantage plan with me. I'd have to get a different plan because it's a different network. And so the whole issue is you have to look at your policy and say, is this something I'm fine with changing every year? I'm fine with doctors moving and hospitals changing and those kinds of things. It's very fluid, volatile plans. Not so with supplemental plans. And all I'm saying today is that don't just look at the premium. Yes, supplemental plans have a premium. Average G plan right now is probably in the neighborhood of $150 a month. The average N plan probably $100 to $110 a month. You got to pay for it, but I believe you get a lot of value for your money. An Advantage plan is going to have a zero premium, and so instead of paying a premium, though, you're not getting off scot-free. You're just going to pay as you go. $400 to $100 a day to go to the hospital, $300 for an MRI, 20% co-insurance for durable medical equipment. So on and on it goes. So you have co-pays and co-insurance on Advantage. So folks, all I'm trying to teach you is that either way you're going to pay. If I only look at the monthly premium, I'm probably going to get an Advantage plan. But if I will look at other aspects of that coverage, the providers that are available to me, the pre-authorizations that I have to go through, the type of policy, permanent and portable, then most people look at that and say, hey, that $110 a month or that $150 a month is money well spent because I get a quality product. Now listen, those of you, and I'm almost done, those of you who cannot afford that monthly premium on that supplemental plan, please don't try to. Live within your means. And if you can't afford it, there's no shame in that. Get an Advantage plan. Get one that is going to serve you well, and work with a broker like us that will care enough about you to show your options, and then on an annual basis work with you to make sure you're always going to be on the right plan. All right. It's not like Advantage plans are lousy insurance, because they're not. I love Advantage versus A and B only. At least you have a stop loss limit and some additional benefits with that. But if you cannot afford a supplemental plan, don't try to do it. I've seen plenty of people in my career now that tried, but if you can't afford it, don't do it. Just get that Advantage plan and you'll be fine. Okay? All right, so I've rambled on a lot about that, and so I hope you'll look at this decision as not just about my monthly premium. There's a lot more to insurance than just that. Okay. All righty. So Daniel is on here with me. So he is actually going to give me the questions. So Daniel, I am ready to take questions, and I'll try to go as long as I can till I get too tired. So here we go, sir. I'm ready. I applied for Medicare A and B a few days ago. When do I contact you folks to choose my supplemental D and G plan? Okay. Well, you actually can contact us now. Your A and B application, of course, is pending. It's in process. And we know that, they're going to approve it. So depending upon when you're going to start your Medicare, let's say that you're going to start in the next 60 or 90 days. You selected your B date based upon when you enrolled, or you select your B date based upon when you're going to retire. But once that B date has been established, then any time within 3 to 6 months prior to the effective date on the B, you can begin to look at supplemental plans. Some states we can submit supplemental plans 3 months in advance, some 6 months in advance. So it's time to do it. So if you've applied, obviously you're going to start pretty soon. So you can work on the supplemental plan right now. We do not have to have your Medicare number or that Medicare application approved, because what happens, you tell us what effective date you've requested with A and B, and then we'll request the same date on your Medicare supplemental plan G. Okay, so you can do it now. Now, when it comes to drug plan, we can look that up, and we'll make sure that your meds are covered, and you can go to the pharmacy you want to, and we can make that decision. But we can't submit the actual D plan application until that Medicare application has been fully processed. Now, just so you know, they're going to mail you a card, but we also have access to systems as well. So we normally can find that Medicare number usually within about 2 to 3 weeks after you've made the application. So we'll work with you on that. Here's my point. So the D plan can be decided upon for sure. We just can't complete the enrollment on that until we have that actual Medicare number. Supplemental plans don't require the Medicare number. They just want to know when it's going to go effective, and then they'll match those together. Okay, so hope that helps. Contact us ASAP, and we'd be delighted and really kind of a privilege to serve as your Medicare broker. All right, who's next? Okay, did you say you also assist with starting Social Security? We do. Now, here's the way that works. If you decide that you want to tie your Social Security together around the same time you want to start Medicare, our agents know how to do that. Some people want to start at the same time. Now, what happens when we do a Medicare A and B only application, that takes about 5 to 7 minutes. When we add a Social Security application to that, then that takes about an additional 20 minutes. But we're happy to tie that together. In fact, if you do want to do it at the same time, that's the best way to do that. Okay, no problem whatsoever. Now listen, you do have to have an SSA.gov account, and then we have to go in there with you, and we'll work with you on that. You'll have an email address, of course, and then a password, and we're happy to do that with you all at the same time. It's frankly quite simple. Social Security can be applied for 4 months in advance of when you want to start your benefits, and Medicare, of course, 3 months in advance. So if you're going to tie it together, we'll help you with that. Let's keep going. All right. Hi, Sam from San Antonio. I have a phone appointment set up with Brock next week. Hey, Brock is a great guy. You will like him. He is just sharp, very sharp. In fact, Brock came to our company, had never had Medicare experience. And so I personally was involved in training him. Of course, we have others as well. But you're in good hands. I think you have a great experience. He's just a great guy. Thank you for letting me know that. All righty. Why are supplemental plans so expensive in Minnesota? Well, the reason is because Minnesota does their system, their Medigap plans differently than the rest of the country. Now, there's actually 3 states like Minnesota, Wisconsin, and Massachusetts. Those are called waiver states. They have their own rules for MedSup plans. They don't follow the standardized plans like all the other states do. And because of that being unique, there's not as many carriers that want to offer supplemental plans. In other words, they're not interested in those kind of plans. They're not bad plans. They're just a little bit more complicated. They're not standardized like the other 47 states are. And so states just say, hey, we're not going to do business there. And so when you have fewer carriers available in that market, that's going to drive up the price. No difference in any issue versus supply and demand. You have a lot of demand for MedSup plans, but you have a tough supply because carriers don't like operating typically in those 3 states. Okay, that's why. Okay, is it best to go with a 0 monthly premium D plan if you're not taking prescription drugs? Absolutely. Yeah, if there is a plan in your area that would have a 0 premium, I would definitely take that. And I'm going to tell you why. Because you can change your drug plan on an annual basis. And so I definitely would. And there are a couple carriers that have 0 plans. Now, and just so all of you know, watching this, not every market has a 0 plan. But you're going to find that there are plenty of plans out there. One of the local markets that we're in where I live, there's 12 plans, and 6 of those plans are from $15.50 a month down, including a 0. And so the point is, half the plans in this particular market here are very inexpensive. And 3 of the plans were between $50 to $80, and the other 3 were above $100. Okay, so yes, it's fine to get that. So if you take no meds, get a plan, and then if something were to change and you had to add meds, more than likely they'll probably be in your formulary. If they're not in your formulary and you need them, then you can ask for a formulary exception, and then you can also always change drug plans annually at this time of the year, October 15th to December the 7th. So not a bad move at all. It's exactly what I would do. Okay, your team helped me get my enrollment done for Medicare in the summer. Good. Thank you for letting us serve as your broker. Hope that you'll always be pleased. We'll do our best, I promise, to take care of you. All righty. SSDI in 2019 wasn't aware of 6 months to pick supplemental, only 58. How can I change from Advantage plan to Sup? Well, unfortunately, what happens is you are more than likely going to have to wait until you turn 65. And by the way, Timothy, tons of people make this mistake. They're just not aware that when you first go on Medicare, you just have this 6-month window of your B date to be able to get a supplemental plan. Now, I also will tell those of you watching Social Security Disability, there's a lot of states, in fact, the majority of states today, you cannot even get a supplemental plan. Federal law does not mandate that supplemental companies make available supplemental plans for those people that are under 65, meaning they came to Medicare because of disability. Lots of states, you can't even get them. There are some states you can, but the states allow the carriers to charge more money. Some states don't, but some do. So the whole point is there is not a huge market for underage supplemental plans. And so a lot of people make that mistake. So here's my point, Timothy. When you hit 65, then you're going to be able to reset the clock, and then you can get that supplemental plan. Now, another exception would be if you lived in a state where there is no underwriting at all, and then that would be New York, Connecticut, Massachusetts, and maybe soon to be Minnesota, because I know they've changed some things recently as well. But the point is, if you live in a state that has open enrollment year round and no qualifications medically, then that would be another way. But again, that's kind of the huge exception to the rule. The rule is you have to wait to 65. Okay, all right. Hope that helps. Let's keep going. I am turning 65 in January. Hey, by the way, me too, Dave. I turned 65 in January. I have been diagnosed with stage 2 COPD. Am I correct that if I want to get a plan G, this would be the only time I could be able to get this plan because of my diagnosis? Is this correct? Oh, yes, it is correct, unless, again, you live in New York, Connecticut, or Massachusetts. Then it wouldn't be. So if you don't live there, yes. And so the reason for that, Dave, is that you're in this period of time called the Medigap OEP. It's an acronym that stands for Medigap Open Enrollment Period. Federal law says that once your B date has begun, you're within a 6-month window, which counts your birth month, 6-month window, where the insurance companies have to approve your application. They cannot ask you health questions. They cannot charge you extra because you have COPD. You get just the standard 65 healthy rate because they can't ask any health questions. Now, from a practical standpoint, Dave, you don't have to wait till your B date starts to be able to get the supplemental plan set up. You actually can apply in advance. Now, your supplemental plan is not going to start until your B date goes into effect, so they'll both go in at the same time. But you don't have to wait. So most people are going to be applying 3 to 6 months in advance of their B date. So they make that decision, everything is set up, and then once their B date is effective on whatever date that would be the first of the month, then the supplemental plan will start at the same time. Now, if someone hasn't made that decision during the 3 to 6 months, they're still fine. We still have 6 months after the B date. Now listen, your birthday is in January. Your 6 months would be January, February, March, April, May, June. So you actually could apply all the way up to June 30th. By the way, wouldn't put it off that long, but you have all the way up to June 30th to apply for a Medigap policy in any company that you choose, any plan that you want, other than Medigap F and Medigap C. You can't get those. But all the rest are yours with no underwriting. Any company you want has to approve your application. Then you'll have that then, for the rest of your life, and they can never cancel it unless you don't pay the premium. Okay, so it is correct. Let's keep going. All right, I wish I could say Advantage was bad, but so far it's been good for me and my husband. And my dad had it a really long time. He was 95 and a half, and it covered most everything for him. Hey, and by the way, I am glad for you. I'm glad that happened. I really am. And there are certainly millions of people that have had that same experience. There is. And so I would just tell you that the opposite is also true. There are some people that have had a very bad experience with Advantage plans. In fact, I don't think I told you about this. Maybe I already told you. I hope not. But I had a lady call in today from Kentucky, and she runs a hospital. She is the CEO of a hospital, and she can't stand Advantage plans. They have all kinds of problem with them. She's getting ready to turn 65, is looking maybe retiring, going on Medicare, and going to get a supplemental plan. And so again, why? Because they've had hassles with the pre-authorizations, with slow pay and no pay, or it's just an issue. But I'm glad, and I hope if you stay on the Advantage plan, I genuinely hope that it works for you. And by the way, it's not like I hate Advantage plans. I just know that there are people that do have issues with pre-authorizations and networks and all those kinds of things that come with that Advantage plan. And so we just simply have to be honest. Now listen, agents love Advantage plans too because they pay us twice the commission. That's why some agents, that's all they want to talk about. They don't want to talk about all your choices. They want to talk about this one choice because as they chase commissions and that's all they care about, they're going to sell you an Advantage plan because they pay us twice the commission, lifetime residuals. So it's very financially advantageous for Advantage to really push Advantage plans. It just is. But again, I hope it continues to be that way. I really do. I want it to be good, but it's not always, and that I know to be true. Okay, let's keep going. All right, I'm in New Jersey. Supplemental Plan C still available for those of us who were eligible for Medicare before 2020. Understand it covers all except 15% excess. Okay, here's the problem, and that not just in New Jersey, it's across the board. If the market is not interested in a particular plan, then an insurance company is not going to be able to sustain that, what we call the block of business. And so there's not really a high demand for C. Now, there used to be, when the F was available, people would look at the F plan as full coverage, a little higher premium, and they'd say, well, if excess doesn't occur a lot, I still want some plan, but I'd like to save a little money. So then they would get the C plan. Like today, people maybe like to have a G, but if they can't afford it, they just downgrade just a little bit to an N plan. And again, very little. And so what's happening today is because there's so few people even looking at C plans, insurance companies are not going to make those available. And again, they may be available as spotty parts in the U.S., but I don't know that. Now, you can still get F plans by most carriers, but not C plans. And so, and frankly, because there are very few people getting a Medigap C, I wouldn't want one because that block is going to be small. And the smaller the block, the less price stability we have. So if you can get an F plan, that's what I would do. I think you're going to be hard-pressed to find a C plan. But listen, as long as you can medically qualify, even if you could get an F plan, I wouldn't. I'd get a G plan. Why? Because you're going to pay probably $100 more a month for that F plan. What are you getting out of it? You're getting out of it an annual B deductible. This year, that's $257 for the whole year. So if you paid $100 a month extra for the F versus the G, you just paid $1,200 for a $257 benefit. Who wants you to do that? The insurance company does. So again, I would not get an F today. Now, there are some of you that have to get Fs because maybe you've lost a group plan or there's been a circumstance you've lost your plan and you can't get through underwriting, so you'll have to get that F plan because you're guaranteed issue F, which means you started Medicare before 1/1/2020 and you don't have to go through underwriting, so you'll get the F plan. And you'll have to pay a premium for that. I still think it's still a fine option. I don't think it's so crazy high. I would never do it, but if I could qualify, I definitely would take a G plan versus the F today. All right, let's keep going. I was just set up to start this month by Justin with my Medicare and the supplemental drug coverage. Do I need to review the supplemental plans and RX plans again with you before January? Well, number one, let me tell you about Justin. Justin is one of our, I truly think our awesomes are awesome, but Justin is at the top. He is a great guy, hard worker, just genuine gentleman. He's just a great guy. So I'm sure you had a good experience with him, Jill. And so let's talk about that. Your supplemental plan, no, you don't have to do anything about that, but we do need to make sure that you are on the right 2026 drug plan. And now I would assume, now I don't know when you started, if you started here just in the last month or so, he would have talked to you about that the new drug plans for 2026 just came out October 1. And so if we set everything up before, we would have had to set you up on a 2025 drug plan. And so what happens is you'll need to make sure you're on the right 2026 drug plan. So when Justin sets you up, Jill, what he did is he gave you a website, MedicareSchoolEnroll.com. MedicareSchoolEnroll.com, gave you a username, which is probably your email, and a password. He would have shared that with you as well. And so you want to put that information in, again, MedicareSchoolEnroll.com, and put that information in. If there's been any change in your drugs, you can update that very easily, confirm your pharmacies, and then push shop plans. And actually, we'll look at all the plans for 2026. And you can do this on your own. It's very simple to do. And then it'll look at those plans. And so it's possible that the plan you're on for 2025 is still the best for 2026, and it will automatically renew. But if it's not, then all you have to do is look at the plans and just take the one at the top. There's usually 9 to 12 plans every market, and just add to cart, and you can do an enrollment in literally 5 to 10 minutes. It's very simple. And that if what I just said sounds a little intimidating, here's what I want you to do. Every day at 2 o'clock, our clients are able to go on to live stream, and we're helping them work through that process of making sure they're on the right drug plan. And we would have reached out to you to give you that particular address for this live stream. It's just for our clients. And so that's another way that you can get some help as well. So my point is, Jill, confirm it. You want to make sure. Don't assume that it's automatically going to be the same plan. Now, I know Justin, because I would have done the same thing. I would have been sensitive to what's going to go on in 2026. But if you were all set up before October 1, we didn't know what was going to be available. So you need to double check on that. And those are the ways that we assist you. Okay, MedicareSchoolEnroll.com, and then these live stream events every day, 2 p.m. Central. And if you don't know that, call in the office, and they'll give you that address for that. Okay? All right, great question. Thanks for letting us serve as your broker. How can I get eye or dental help with the supplemental plan? Is everything separate? Well, first off, let's talk about this. When it comes to eye care, with original Medicare and the supplemental plans, it is awesome coverage. Okay? It really is. The only thing, folks, that original Medicare and your supplemental plan are not going to cover are 2 items when it comes to vision. Number one, Medicare will not cover preventive eye exams. Preventive, meaning you're not having a health issue. You just want to know if your eyes are healthy. Okay, that's not covered by Medicare. Now, if you are having some blurred vision, you're seeing some floaties and all that kind of stuff or whatever, well, then that's medically necessary, and that is covered by Medicare. So Medicare will cover medically necessary eye exams, just not preventive. And the only other thing Medicare doesn't cover is eyewear. Okay, other than after cataract surgery, you can, after cataract surgery, get a new prescription. And so those are the 2 items Medicare doesn't cover. So what you can get, if you're going to have a supplemental plan, you can buy a standalone vision plan, iMed Network, VSP Network, and those cost anywhere from about $15 to $18 a month. And normally, you can buy those alone, or you can add those to a dental plan as well. Now, let's talk about dental. Here, the story is different. Medicare does not cover dental well at all. It has to be some major catastrophe for Medicare to cover dental, such as you have jaw cancer, That's going to, the surgery is going to require then some adjustment, going on in the jaw, but also the teeth. So that's huge. Someone is in, maybe a bad accident, a fall or something, and there has to be some reconstruction of the teeth. It's medically necessary to do that. Again, that will be covered by Medicare. But our normal stuff we need, cleanings and extractions and fillings and root canals and crowns and implants and all that kind of stuff, you're going to have to buy a dental plan. And we write a variety of them. I can tell you right now, probably the average is going to be somewhere kind of a decent plan, but not a lot of coverage, about $25 a month. High side would be about $75 a month. Now, a $25 a month plan probably cover your couple cleanings, maybe $1,000, maybe $1,500 with the services beyond cleanings. $50 plan, a couple cleanings, a year, x-rays, and maybe $2,500 to $3,000 a year coverage. And then your plan that's $75 a month, we like that plan. We like it because it has implants, and it actually covered $10,000 of implants annually. Now, you have a year waiting period. But that's a good plan for that as well. So again, we write plans. About half of the people that we serve on Medicare supplemental plans get standalone dental plans, and the other half do not. They just have healthy teeth, or maybe their dentist doesn't take a plan, or their dentist has their own plan, all those kind of things. So by the way, let me share this with you. Listen. If you want a dental plan, the best time to get it is within 30 days and no more than 60 days and when you leave your group plan. Because if you wait beyond 30 to 60 days and you come to get a dental plan, then you're going to have some sort of a waiting period. Could be 6 months, could be 1 year even on major stuff, or they could maybe until you've gone through this period of time, they don't give you quite the extent of coverage. And so again, if you want a dental plan, folks, try to do it within 30 to no more than 60 days, having lost a group plan at work. Okay, and then also sometimes you actually can COBRA your group plans at work. We recommend that a lot of times because normally the dental vision is separate from the medical, and so if they allow you to COBRA that for 18 months, sometimes that's in your best interest as well. All right, so that's the way it works. Let's keep going. I signed up for Medicare through my state and will utilize that. Okay, can I not take Medicare and avoid that $185 deduction of my SSI monies? Okay, no, the only people that can do that to avoid, you're talking about Part B. The only one that can do that would be if you're retired from the federal government. Now, let me pause. We write in all states. I have never heard of a state that allowed you, once retired, to take A only. I've never heard of that. So I don't want to say it's not out there, but that would be a new one on me. So, but the federal government, your retired civil service, meaning, FBI, IRS, Homeland Security, Treasury Department, whatever, any place you served as a civil servant, when you retire, you have a program called FEHB, Federal Employee Health Benefits. And so they will allow you to have A only. Okay, they will. So if you're retired and you have a medical issue, hospital, then Medicare A pays first. Your FEHB plan pays second, which is usually GEHA, FedBlue, one of those carriers. So if you don't take B, what happens? Everything that B would cover, which is basically everything outpatient and all doctor services, all in and outpatient doc services, then your federal plan pays first and then you pay second. That's the way it's going to work. So if you want to avoid the $185, you have to work for the federal government for that to happen. Or what you can do, sorry about that, that's my dog. If you, hang on, Chief, no. He's looking outside. Anyway, so what you can do is, if you're a veteran and only want to go to the VA, and that's it, you're happy with the VA long term, then what happens is you can enroll into A only and not take B and just use the VA. Now, here's the problem with that. You don't know long term if the VA is going to keep servicing like you like they are now. I hope they do, but you don't know that. The second thing is, if you ever want to get into Medicare B, and this happens to federal employees as well, you took A only, veterans A only, and then you want B at a later date, you can only come in and pick up B the first quarter of the year. That's it, January, February, or March. And for every year you went without Medicare B, even though you didn't have to have it, you could have had it, they charge you 10% penalty added to your Part B. And that's a lifetime penalty. So 1 year without is a 10% penalty added to Part B, and you pay it for life. 2 years without, 20%. So the point is, there's penalties and consequences for not taking B when either you retire or at 65 if you're no longer working. Okay, so you can do it if you want to avoid it, but I wouldn't suggest it whatsoever. Okay, let's keep going. All righty, can I stop having Medicare? I can no longer work because I'm disabled. I'm eligible for, mass health coverage now. Okay, well, that's interesting. I don't think so. Now, here's what when I see mass health, I'm assuming I'm assuming maybe you qualify for Medicaid, but the problem with Medicaid is that it always pays second. So anyone that's eligible for Medicaid and Medicare has to also be enrolled in Medicare. But here's the thing: in most states, that Medicare Part B premium is going to be covered by Medicaid. So when you apply for that, it's called extra help or low-income subsidies. There's a variety of programs, Medicare savings programs. And so you should be able to get some help with those Medicare B premiums. And so what I think you ought to do is look at, of course, Medicare A and B, and then see if your state will actually pay for that Part B premium for you. And it could be that then you'd qualify for what we call a dual SNP plan. That's a dual eligible plan. That's a special needs plan for Medicare, Medicaid eligible people. And those are really, really good plans. So that's what I think you should do. Stay on Medicare, see if Medicaid will pay the B premium, and get a dual SNP plan. Now, folks, listen, I have to plug in my computer, and I'm really, really sorry because it's going to go dead. I didn't realize how low it was. Oh, boy. Okay, let's keep going, Daniel. I'm going to have to find a cord. Hey, babe, would you do that? Yeah, I need one. Hey, babe, there's one inside of my briefcase. Thank you. All right, sorry about that. Can I stop? We already did. Daniel, let's take the next one. Kat's going to get me a cord. I heard that in Minnesota, law is going into effect 2026. If you have an Advantage plan, you can switch to traditional Medicare until you're age 70. Have you heard this? Interesting. What? And you know what? And I'm sorry. I do know for sure that Minnesota did pass some laws recently, and I'm not up to date on all of those details, and I'm really, really sorry. Daniel, put that on our list. We need to do a little bit of research on that. But I do know that that they were going to have similar to. You see what? Yeah, it's in that case, babe. I don't know how we get that plugged in though. Okay. It was in like a paper case. Oh boy. There you go. That's it. Okay. All right. Let me tell you about this. Hey, doll, you gonna plug this in? Okay. 841 of you. This is my wife. Say hi. This is my wife,
Hello.
Kat. She is wonderful. Okay. There you go, doll. Okay. Now, what I do know is that Minnesota is going to be similar to New York, Connecticut, and Massachusetts in that they are going to have an expanded open enrollment period, which means there's no qualifications during that time. What I did know, Kim, is that it stops at age 70. That would be a new one on. Okay, Daniel. Can everybody hear me now? Daniel, can you hear me? Oh, good. Okay, folks, I am really, really sorry. I did not know that my computer was that low. My bad. Okay, let's go back. We were talking about Minnesota, so let's continue. We're good. We're good. Thank you very much. All right, Daniel, I'm ready. I see that my wife broke the internet. Okay, if a supplemental plan is permanent, can the premium go up? Yes. If so, can you easily switch between supplemental plans? Okay, it is permanent coverage. They cannot change the terms of that G, F, or N plan or whatever you get, but the premiums will go up. They're going to go up because of inflation for sure. If companies would price something where there's never a price increase, it would be so crazy high, no one would even get it. So again, just like everything else in our life, inflation is going to affect the cost of our supplemental plans, and they will go up. Now, historically, folks, it's been like 5 to 7%. Last couple of years, it's been 10 to 20%. It's been very frustrating. But we do think that as inflation begins to stabilize in our country, we'll start seeing some more stability in the supplemental market. But yeah, they are going to go up for sure. Now, as far as switching easily, it just depends on where you live. If you live in what's called a birthday rule state, it is easy without underwriting. And so those birthday rule states, there's about a dozen of them, and that is California, Oregon, Washington, Idaho, Nevada, Oklahoma, Louisiana, Missouri, it's called anniversary rule, Illinois, up to age 75, Kentucky, Virginia, Maryland. Okay, and again, now we have some other states that are doing some additional items, New York, Connecticut, Massachusetts, Minnesota. So you do have a handful of states, no, more than that, you have more than that, you have a dozen states where you can switch plans and usually carriers. Meaning you can, if you have a G plan, you can move to another G plan or down to an N plan. If you have an F plan, you can move to a G or an N. So we call this a switching like to like or like to less. And so that's possible in those states where they have the birthday rules. And it just simply means during a period of time around your birthday, usually 30 days before, 30 days after, maybe 60 days after, you have that window where there's no underwriting. Now listen, you can move a supplemental plan anytime you want as long as you get through underwriting. So we'll do it anytime when people are healthy. But if they're unhealthy, then if they're in a birthday rule state, we have to wait to birthday time. And if they're not, then you're going to have to stay on your supplemental plan. And that's why it's so important to make sure that you look at the rate increases that a company's taken in the last 3, 5, 7, 10 years. And as long as that information is available, we'll look at that. We want to look back to see how many price increases that company has had, because some go up more than others. And so we want to select a carrier that has been stable. Okay, so hopefully that helps. We can switch, and it's easy if you're healthy. If you're not, could be an issue. Okay, let's keep going. All right, 67, still working. Signed up for A when I retire February 2026. When do I need to have a plan decision made by? Okay. All right. So I'm assuming let's say it this way. If you retire in February during the month, then your group plan will probably cover you to the end of the month. So that tells me you want to start in March 1. So if that's the case, you want to back the clock up 90 days. So let's back up February. Let's back up January. Now we're into December 1. And December 1 would be ideal. Now, if you need coverage to start in February, then November 1. And here's why, folks. When we come into Medicare after 65, as this person is at 67, you're coming into Medicare using a different enrollment period than you do at 65. At 65, we call that the initial enrollment period. It only lasts 7 months. 3 months before you turn 65, the month you turn 65, 3 months after. So I have to make my decisions during that 7 months. But if I come in later, what happens? We have some additional paperwork that's required. One, we got to verify credible coverage through your employer or employers, whoever you've had back to 65. And we have to pick the date we want to start. And that paperwork cannot be dated any later than 90 days of your effective date. So again, if I'm going to start March 1, then the ideal date is going to be December 1 to start the process. If it's February 1, then again, November 1. No sooner than 90 days when we'll do that SEP paperwork, stands for Special Enrollment Paperwork. And just so you know, you work with our company, and we'll do all that for you and with you. Most agents don't even know how to do that, can't even touch that paperwork. But we do, all day long we do it. And so we'll help people get into A and B, whether that's at 65 or it's at a later date when they retire beyond 65. We know how to do that, and we'll make sure it's done properly for you. So we kind of come alongside and assist in that whole process. Okay? All right, let's keep going. All righty, my dad has a supplemental plan F. Why is it so expensive? Well, your dad started Medicare before 1/1/2020, maybe way before then. And so what's happening, those F plans, those folks are aging, therefore more claims, and less people have those F plans. So that's what's happening. It's the larger the group, the more stable the rates, the cheaper the price. But as people pass away and get on different plans, that group begins to shrink. And so the claims are having a greater impact upon those people. I give a silly illustration, but it's very true. And that is, if you're in the ocean and you're in a canoe, you are going to feel every wave that hits that canoe. In fact, it could be quite a rough ride. But if you're in a cruise ship in that ocean, you usually don't even know you're even in the ocean. It's such a smooth ride. So why? You have a large vessel in the ocean versus a small vessel. And so whenever we look at supplemental plans, the same thing can happen. If you're on an app plan or even sometimes other plans, but you're with a carrier that does not have a large market share, a small group, that's the canoe. And the waves are when people have health claims and problems. And so I want to be in a cruise ship. I want to be with a company that has a large market share. That's why we don't write for certain companies. They're new to the market and they're not going to have enough a client base, and those rates are not going to be stable. So we like national carriers, ones that have a good market share and a lot of policyholders, because that risk is spread out to lots of people that's on that cruise ship. You're not going to feel the waves near as much. And so that's what we go after as a company. I really don't have favorite companies. What I have are companies that I know are national that have a good market share, because I think it's going to give my clients better rate stability than what a smaller carrier, regional carrier is going to give us. All right, let's keep going. That's why. By the way, you can get off of it. As long as you can qualify, call us and let's move that thing and see if we can't get him moved to a G or an N. We'll be happy to help with that. Okay, I'm getting medical care at the VA. Do I need a supplemental plan? No, you don't. Now, listen, I've written plans for plenty of veterans that still want a supplemental plan because they wanted to have that civilian option, and money was not an object. But if money is a little bit maybe tighter and you're happy with the VA, you're just happy with that system, and you don't want to afford a supplemental plan, then don't. I don't think you're crazy for not getting a supplemental plan in your situation. But let me tell you what I would do if I were you. If I were you, is this. I would enroll in what is called an MA-only plan, Medicare Advantage only. And in those kind of coverages, what that means, MA only means it's for medical. It's for inpatient, outpatient services. It does not include prescription drugs. Why? Because you can get your prescription drugs through the VA. And so because you get your drugs through the VA, when that insurance company, Medicare Advantage companies, they get paid per month per member. Anywhere from $1,000 to $3,000 a month, Medicare pays the Advantage company. Medicare Advantage plans don't pay providers. They don't pay bills. They pay the plan. So what they do, if you have an MA-only plan, the money the Advantage company gets from the government, since they don't have to cover your meds, they will give you a credit back towards your Part B premium. They'll increase your Social Security check or decrease your Part B bill if you're not on Social Security. So they're just simply taking some of that money and they're repositioning it to help you because, again, they're not responsible for your drugs. So that's called an MA-only plan. Now, why do I like it? Because now you have a civilian option, one that has some perks, gym membership, hearing aids, possibly dental allowance, vision allowance, and some of those perks you can take advantage of, and it'll be a zero premium, and you'll get some money back towards your Part B premium. So I think it's a win-win, and it's not permanent. If you don't like it, get off of it. You can always go back and just have the VA only. But you do have to be enrolled in A and B to be able to get one of those MA only plans. But again, they'll offset some of that B premium. So I think it's a great, great decision. Okay, so that's what I would do. I wouldn't get a supplemental plan. Though I love supplemental plans for your situation, not really necessary. All right, who's next? Still working as well and have full coverage. Can I switch to Medicare even after the open enrollment deadline, August? Yes. Yeah, for sure. So what happens, folks? Listen, the deadline has nothing to do with getting into Medicare. This deadline that we're up against now, October 15th through December the 7th, that has to do with Medicare Advantage plans and supplemental plans. All right? Now, when you talk about this August deadline, I'm not sure what you're talking about. Maybe you're talking about your birthday, your open enrollment. I'm just not positive about that. So let's address it this way. Getting into Medicare has nothing to do with this time of the year. Okay, it just doesn't. This has to do with people switching Advantage plans and switching drug plans because those plans are only annual. And so when you're still working and you're going to come into Medicare when you retire, you're coming into Medicare using what is called the SEP, Special Enrollment Period. And all we have to do to get you qualified for an SEP is to verify that you have been working or your spouse was and you had work insurance back to 65. And as long as we have no gaps in that coverage from 65 to when you retire, and we prove that with these forms, then there's no problem coming into Medicare at any time. Hey, I brought people into Medicare at 79 and 83, folks that are well into their 70s. Still were working, got a Medicare, and now we bring them in. Why? Because they had credible coverage, working, and had insurance at work back to 65. That's the key to an SEP eligibility. Okay, let's keep going. Oh, man. Okay, how many guides do you have? Well, our company has 100 employees. Okay, 100 employees. And so what we have is about 50 of our staff are licensed. And then the other 50 would be support staff, customer service, managers. We have reception personnel, enrollment team. I mean, we have a lot of people who do a lot of things. And so that's our staff. So 100 in our home office, and everyone comes to the office. We have some remote people. They kind of earn work from home privilege, but we're primarily in the office. And so, anyways, that's the way we do business. Let's keep going. I know there's been one drug plan to choose in Connecticut. Really? I did not know that. That is a bummer. Only one. And hey, Clayton, did you go to Medicare.gov and find that? Man, that's really sad. Yeah, I did not know that. In most markets, the average right now is somewhere between 9 to 12 plans. Yeah, well, that's a bummer. I don't know what to tell you on that. I really don't. I don't know what Connecticut. I just don't know. That is shocking to me. But okay, is there a way to see the same Plan B pricing like advisors see? Well, are you talking about? You see Plan B. Plan B is Part B of Medicare, so maybe you mean Plan G. Let me tell you what you could do if you'd like. Go to medigapcompare.com. Medigapcompare.com, and we own this site. And when you go there, what it's going to do, it's going to show you the lowest 3 supplemental plans in your area based upon your age and your gender. So that's one way to do it. You can see, I mean, we don't hide it from anybody. You call in and work with us, we'll tell you exactly what the prices are. No problem at all. But that Medigap Compare, and again, it looks at lots of carriers, but only gives you the lowest 3 carriers in your market. So medigapcompare.com. And again, it's us. So it's reliable. Let's keep going. All right. If I cancel prescription insurance besides not having meds, will I never be able to get Medicare? Oh, sure you can. I wouldn't do that though. But prescription drug coverage is voluntary for sure. So if you cancel it, what's going to happen once you cancel it, for every month that you go without, there will be a 1% penalty, and that 1% is of the national average drug plan, which is basically about 40 cents a month. So let's say you go without for 12 months, that's $4.80 a month, added to your future Part B and Part D premium. So once you pick up a plan again, then those penalties are going to be charged to you. So again, about 40 cents a month. So if I have 12 months, that's $4.80 penalty for that year. But they add that penalty to your premium every single month. So if you go without 1 year, basically $5 a month extra. Go without 2 years, basically $10 a month extra for your plan for life. And that's why I wouldn't do it. But that's not the biggest risk for going without a drug plan, folks. The biggest risk is needing drugs and you can't get them, okay, without paying cash. Drug plans, all of them have a $2,100 max. That's why the drug plans were so disrupted this year. The government said you'll spend no more than $2,100 out of pocket for your meds the whole year, as long as that drug is in formulary and you're getting it through the plan. That's the max you'll pay. Listen, I have folks that are on meds that are $30,000 a month. I'm telling you right now, folks, Stelara is over $30,000 a month. It's I think it's a Crohn's disease, psoriatic arthritis type of medication, Stelara. I know it's autoimmune disorders, and it's expensive. But if someone's on that medication that's $30,000 a month, they'll spend no more than $2,000 for the whole year this year. Next year is $2,100. So that's why you get a drug plan. Even if you don't look at today. You could need something in 3 months. Listen, self-administered chemotherapy pills are $5,000 to $7,000 every month. Okay, and if you have a drug plan, you'll spend $2,000 for the whole year, and you're done. Get a drug plan, please. But you can get one later, but you'll be penalized, and the only time you can get it is October 15th to December 7th. So you can't add it when you get sick in February and you want a drug plan. Too late. You've got to do that in advance. All right, Daniel, let's keep going. All right, my Medicare Advantage plan is not being renewed for 2026, okay? They aren't offering it anymore. Can I now get Medigap insurance without disclosing my medical history? I live in Chicago. Well, here's what happens. Yes, you can. In fact, you can do this whether you live in Chicago or wherever. When a Medicare Advantage plan is terminated, then you have a guaranteed issue right to go back to original Medicare and get a supplemental plan of your choice based upon when you started your Medicare. Okay, so if you started your Medicare before 1/1/2020, you have to get a supplemental plan F. If you started Medicare after 1/1/2020, you have to get a supplemental plan G. Those are the guaranteed issue products. You just can't have anything you want. It's all tied to when you started Medicare. So my Medicare Advantage is terminated. I can get a G or I can get an F. No underwriting at all. Okay, let's keep going. My wife and I got our supplemental plan in just today. Very pleased with Matthew and Lisa. We're in Connecticut and are good to go. That's great. I'm glad you had a good experience. And so were you the folks that said there's only one drug plan in Connecticut? Because I really was not aware of that. But thanks for letting us serve as your broker. We appreciate it very, very much. All right, let's keep going. Supplemental plan is a better option for snowbirds, and is Florida cheaper than New York for premiums? Well, for sure, Florida is less expensive than New York. And so I personally think supplemental plans are better across the board when people can afford the premium. Snowbirds are not. The nice thing about it is snowbirds, you know that card that you pull out, your A and B card and your supplemental card, is going to give you the same coverage whether you're in New York or Florida. It just doesn't matter. You're in Alaska or you're in Louisiana. It doesn't matter. So that's the advantage to those. And they are cheaper definitely in Florida. Florida is what we call an issue age state. New York is a community rated state, and that's why the rates will be lower in Florida, just the initial pricing. In New York, everyone gets the same price, community rated. Whether you're 85 or 65, you get the same price. And so the 85-year-olds get a bargain, and the 65-year-olds have to pay more. Florida does not do that. Your initial rate will be based upon the age you are when that policy is issued. That's what that means, okay? And a lot of people today in Florida, I think Florida is one of those states that's the N plan is more popular than the G plan. And again, they're both fine, but I think pricing on the N plan in Florida is a little bit more attractive. All right, next. I'm switching to WellCare, and I'm a little nervous about it because the premium is only $550. I take 6 different meds, including Manjaro. This makes me nervous. How can the premium be so low? Here's why. Because just like Advantage plans are the Medicare Advantage companies get paid per member per month. They get subsidies, a flat. They call it capitation. That's the rate they're paid. Just like Advantage companies get that, that's the way it works on drug plans as well. So the government pays them a certain amount, and they call it a bid amount, and they get this certain dollar amount. And so you're looking at a WellCare plan. And so what WellCare has done actuarially, they've looked at their formula and have said, we're able to take the money the government gives to us and a small premium, and they can still make a decent profit margin off that plan. Now, here's what you have to be aware of. And by the way, I'm not at all concerned about the WellCare plan this year. But what you're going to have to pay attention to is it is a fine plan, but it's not going to be huge, broad coverage when it comes to lots of brands. There's certainly going to be brand names covered in the formulary, but not as many. And so there are some times when people are taking maybe 3 or 4 brand names, and that $550 plan is not going to work for them. They're probably going to need something more in the maybe $50 range or $60 range, or sometimes even higher. But here's my point. If the meds that you're on right now are covered well by them, and you've got low out-of-pocket cost, including the Manjaro, and the premium's good, I would enroll in that plan. because then again, if something changes next year for your health or your meds, then you can always switch your drug plan once a year. So that's what I would do. I would enroll the plan. I wouldn't be worried about it. If you need a medication that's not in formulary, you or your doctor can ask for a formulary exception, and usually they approve those and they'll add a medication to your formulary. Okay? That's the way it works. Okay, current medical plan you care is not being renewed, Minnesota this year, so I need to find something new but have no idea where to start. Well, why don't you call us, okay? Just give us a call. There's a number there on the bottom of the screen. Call in and ask to speak to an agent right now. In fact, our office is still open. We're open until 7 p.m. Central Time this evening, so call in. We write in Minnesota, and the agents then can talk to you about your different options, okay? Yeah, I know things changed a lot this year in that state. So that Advantage system just changed. So, okay, next, Daniel, is there anybody else? All right, 66, covered by employer insurance through 12/31. Signed up for Part B today. Can I sign up for SUP? Yes, you can before officially being approved for Part B. Yes. Any guess on government shutdown for any Part B app? Well, I think the Part B applications are still going through. I mean, we've had people applying. It seems to be following the same process. I don't think there's been a huge cutback within the Social Security offices where they're actually processing those. I could be wrong, but I haven't read about that. So they're still working and still processing those applications. So you should be fine. But yes, you can do your supplemental plan right now. Okay, I'm assuming that you're going to start your Part B 1/1, so you can select a supplemental plan and a prescription drug plan right now. And we'd love to be the brokers to help you do that. So give us a call. And again, you can call in live and talk to an agent, and they'll spend the time with you. Hey, it's interesting. I tell you this story today. I was talking to a guy. We're in the second floor of our building, got a huge office, and I was talking to a guy that was just there for an appointment, and he said to me, because he came in, because sometimes people locally do, and he said, I said, who'd you meet with? He told me who it was, and he said it was great. He said, I thought I was only going to get about 15 or 20 minutes of her time, and she spent over an hour with me. And I said, well, that's what we're here to do. We're not going to, rush you, force you to do anything. We want to be thorough in our education. And so that's the experience you're going to have when you call in, folks. The agents are not going to be pushy. They're not going to rush you. We want to do discovery to see what your situation is. There's a way that we can help you. And we'll spend the time that's necessary to make sure you're getting taken care of. That's just the way we think, and that's the way we operate. Okay? So give us a call. We'd love to help you and serve. All right. I did not take any prescription drugs, and your broker Aaron recommended WellCare Value Script. Good, as my Part D, $17.40 per month. Why didn't he suggest a zero deductible plan? I'm in Southern California. Zero deductible, you mean a zero premium plan, I think is what you mean. Well, here's the thing. I know Aaron well, and good agent. So I would suspect that there was not a lower premium plan in California that was available. That's what I would suspect. Now listen, if there is one out there that is less than $17.40 a month, then call us back and let us know about that. But every plan that we can write, we write. So I'm assuming that was the lowest cost plan in California. Anyway, so when you say zero deductible, I know you meant zero premium, and they're not in every state. In fact, I looked on one state today, their lowest premium plan was $9.60. They did not have a zero premium. So that WellCare Zero and Humana Zero are not in every state for sure. So that's my assumption there in regards to what Aaron recommended. Okay? But call us back. If there's one cheaper, then hey, we're happy to get you on that plan if we can. Daniel, anybody else? Okay, do you have to pick a plan? Can we just have Medicare? Yeah, you can just have Medicare A and B. The problem with that is you're putting yourself in a huge risk position because Medicare doesn't pay for anything 100%. And that's important to note. Other than preventive, Medicare is you're going to have a bill. You're going to have a balance of the bill. Sometimes that's as much as 20% of the bill. And so if you have Medicare A and B only, you're responsible for all the things that Medicare doesn't cover 100%, which is everything but preventive. And so you're asking for disaster. So my opinion is this, folks, if you cannot afford a supplemental plan, I would not get A and B only. I would enroll in A and B and get an Advantage plan because at least there's a stop loss limit. At least they're going to have a max out of pocket. A and B by itself has no stop loss. It keeps going and going and going. In fact, that's why the second largest holder of medical debt in the country are people on Medicare. That's phenomenal to me. $230 billion of medical debt to date on the books, unpaid hospital bills, doctor bills. And the second largest holder of that debt are people that are on Medicare. Why? Because they had A and B only. Sometimes they had a Advantage and couldn't afford the max out of pocket, but the majority of them had A and B only. So I wouldn't do that. That's just not a good option, please. At least get an Advantage plan because they'll stop it. You have a max out of pocket of maybe $3,000, $4,000, $5,000. You have no max when it comes to original Medicare. It's unlimited max, okay? All right, Daniel, let's keep going. Will the doctor tell you in advance that they're going to overcharge by 15%? Is there any way of knowing ahead of time of something like this? Yes, yeah. This is called a doctor that doesn't take assignment, and they will let you know, and you can ask them. They're not going to lie about it. They're not going to hide it from you. There used to be a website that we could go to, but it was never kept up to date, so I wouldn't rely upon that. I would just call the provider, and you don't have to ask them if they charge it. Just ask them this question: do you take assignment? Do you take assignment? Because a doctor that takes assignment will not add the 15%. Okay? And by the way, there's at least a 95% chance that you'll never see excess. So less than 5% of the doctors could do it, and even the ones that could do it don't always do it. So you don't have a high probability of seeing excess. But if there is a doc that will do it, they will tell you. Okay? And I think they even have to tell you and have something in writing. I think they have to sign something. That they told you. Okay? All right. My employer is paying my COBRA premiums for 8 more months. I will be 70 in 5 months when I start Social Security. I have Part A, but not Part B. Can I wait to get Part B until the COBRA premium? No! Do not do that. Do not do that at all. And I'm going to tell you why. Because once that Part B starts, once your employment ends, that COBRA provider is going to the second payer position. God, let me say it again. Once your employment ends, that insurance on COBRA now, COBRA only pays second. And so you have to enroll into Medicare A and B to put Medicare in the first payer position, and COBRA is going to pay second. Okay? And if you don't enroll in A and B, or you're enrolled in A but not in B, then you are the first payer. So you can't do that. Now, listen, it's all right to keep your COBRA for a while, but you got to enroll in A and B. And then what I would do is make sure you don't stay covered by the COBRA plan any more than 6 months, because I don't want you to miss that period of time where you can get a Medigap policy without underwriting. So let's just say your COBRA starts, let's say November. Okay? It's all right to be your A and B pays first, COBRA pays second. All of November, December, January, February, March, and April, you can use your COBRA coverage. But let me count it again. November, December, January, February, March, April. So then by May 1, before May 1, April, that you'd want to enroll into a Medigap policy. So it starts 5/1. So you didn't miss that opportunity to get that Medigap policy without any underwriting. That's the way to handle it. Now, if you have a spouse or children that are still covered on the plan, you can still keep the COBRA, and they'll use the COBRA insurance, but you're no longer going to. Okay? So that's the way it works. COBRA only pays second to Medicare. And great terms by the employer, but you got to get Medicare. Okay, let's keep going. If I continue Plan G and reach a point I can no longer afford it, would I be unable to obtain another plan, or would I be stuck with nothing? Oh, no. No, if you can't afford it, then what you can always do is you could move to an N plan if you wanted to, and you could even do that now. It's still a great plan. Or if you need to eliminate premiums totally, then you can always get an Advantage plan. Now, here's the key. You can only make that plan change from Sup to Advantage once a year. And that is this period of time right now, October 15th to December 7th. Medicare has a lot of enrollment periods, but the one moving from Sup to Advantage once a year, October 15th through December 7th. Your supplemental plan would be yours through 12/31, and that new Advantage plan you selected starts 1/1. All right, Daniel, let's keep going. If we go to G, don't we have to get a B plan too? Yes. Yeah, you have to be enrolled in Medicare B and A, of course, to get a supplemental plan or an Advantage plan. Yeah, you would never have because the G plan is paying second to the Medicare B. So if I want Advantage, I want a Sup, have to have A and B. Okay, Daniel. Here we go. Can I only have Medicare Part A, B, and D with Tier 1 generic drugs for blood pressure if I'm fairly healthy? How much Part D will cost me? Okay, well, what I would do if I were you, I would not do A, B, and D. I would enroll in A and B and get an Advantage plan that includes a prescription drug plan. That's smarter. And I'm going to tell you why. Because some of the Advantage plans have very nice drug plans, part of the package, and you can get those at a zero premium. And the reason I'm saying do it that way, because then you will have a max out of pocket on your Advantage plan. Your A and B does not have a max out of pocket, folks. You have a health problem and you're going to be paying 20%. You're going to be paying the hospital deductible. There's a lot of copays and coinsurance that exist in original Medicare system, and you're going to have to pay those out of pocket. So it's a huge risk. So what I would do, enroll in A and B, get an Advantage plan that includes drugs, and you'll still have a zero premium plan. Okay? But if you do it that way, you can, because you don't have to have a supplemental. You don't have to have an Advantage plan. A, B, and D, I'm just saying to you, would be too risky for me. Okay? And a D plan varies. They could be anywhere from $15, $20 a month down to zero, or over $100 a month if you took a lot of meds, and of course you don't. So you can get a very inexpensive Part D plan, or included within the Advantage. Okay. Clueless about Medicare. How do I learn the basics? Okay. Here's what I want you to do, Ivan. Please go to our website, our main company website, medicareschool.com, medicareschool.com, and then you're going to see a button to click on what is called a workshop. It's a free workshop. It's an essentials workshop. I did it. It's 50 minutes. I do a new one every year to make sure everything's up to date. And if you'll go that, it'll be 50 minutes of your time invested well. And I promise you, you're going to walk away and say, wow, now I understand what's going on. Okay, so that's what you ought to do. And we have a YouTube channel. I have a lot of videos there. One of the ladies within our company, great teacher, Erica Smiley, has a lot of videos. There's lots of things you can learn on YouTube, but I would still go to our website first, because that'll give you kind of the A to Z, everything about Medicare, and then you can begin to fill in, some of the fine-tune that different things through our YouTube channel. Okay. Enjoy it. That's why we put it together. I haven't received any an ANOC for my Medicare plan, G or RX. What can I do? Can I see those online? Mindy, I don't know that you can see them online, but I want to note something here. You are not going to get an ANOC for your plan G. Okay, the ANOC is for Part D plans and Advantage plans, because those change year to year. Your supplemental plan G, the coverage never changes, so that's why there's no annual notice of change. Now, your premium can change, but that usually you don't know about that until 30 to 60 days before the policy anniversary. So again, no ANOC on G. So what I want you to do on your drug, I want you to call that customer service line on the back of your card and let them know you didn't get your ANOC and you want to see it. And they should mail you another copy. And if they don't, what I would do, go to our website, medicareschool.com, medicareschool.com, and put your username in there and your password, and then go on the Part D block, and you'll be able to look at all the Part D plans and make a comparison. And then you won't have to worry then about your annual notice of change. If the company doesn't send it to you, you can then go and do your own comparison to see what's going on in those plans, because those plans are going to have a summary of benefits, and it'll show you everything that's on each of those plans. So that's another way that you can find the information you're looking for. Okay, let's go. All right, you sell all insurance companies. I saw another company, Plan G, on the Medicare site that looks good. Going from ACE, looking at Old Security that has issue H pricing. Okay, no. Old Security is a company we do not write for. They're out of Oklahoma. And let me just tell you, and you can go with them. I would say I personally probably have more clients than they probably have in their whole book of business. I could be wrong, but nevertheless, you're not talking about a large block there for sure. I think that, and it's not called Old Security, it's called Old Surety. But the issue is this: when it comes to issue H pricing, many times that is pitched as though that is for sure going to give you more stable rates. And that's simply not true. It's not. The method of pricing does not determine the stability of rates. Community, issue, and attained age. Now, it could be that would be stable, but it's not stable because it's issue age. Issue age just simply means that the prices cannot go up because of age. You start your initial premiums based upon your age, but the issue age with Old Surety is still going to go up when you have group increases, okay? So they're going up no matter who you do business with. So what I look for would be a large presence, a large block of business in your particular market. That's what's going to give you stable. It's not issue age that gives you stability. It just is not. It's not Old Surety that's going to be able to guarantee stability because that's what they write. Now, if you go with them, it's fine. They're a fine company. But again, they're not going to have a huge market presence. But I know how it is. They're going to push, hey, we do issue age, and people think that it's never going to go up because it won't go up because of age, but it's still going to go up because the group will absolutely go up, guarantee you. All right, let's keep going. All right, these Medicare cover mental health visits. Yes, they do. Now, I think there has been a change on telehealth mental health visits, but mental health, yeah. But as far as seeing a provider, yes, face to face, and so they will. Now, I know they only cover as far as mental health. Inpatient stays, I think we get 190 days, if I'm not mistaken, lifetime benefit on inpatient mental health. But mental health is covered just on just regular, visits to a psychiatrist, psychologist, other, clinical social workers, whoever it is that takes Medicare, that would be covered. And that would be an 80-20 visit. If you have a supplemental plan, then it could pick up your 20%. That's the way it's covered because it's on the outpatient side, the B side of Medicare. So yes, mental health is covered. All righty, good day. My question is, I have a Medicare Plan A and B and also health insurance with my recent job. I'm planning to cut my work insurance and apply for Medicare G plan. Is that good or not? Okay, I think that's fine to do that. You just want to make a comparison. And since you already have B, my question is, are you beyond your 6 months of your B date? Because if you are, then you may have to qualify to pick up a supplemental plan depending upon where you live. If you're healthy, it will not be an issue. And so is that good or not? I think it's fine. So there are a lot of people that continue to work and just say no to the group plan and yes to Medicare. That happens all the time. So we just encourage people to, to kind of compare them, premiums, coverage, all that kind of stuff. But because you already have A and B, to me, that would make sense instead of having that work insurance. Because right now, if your group is 19 or less, Medicare pays first, your group pays second. If your employer has 20 employees in the payroll or more, that's 20 or more, then what's happening is Medicare is paying first. Your group plan pays first and Medicare pays second. So I don't really like that. So I would have a supplemental plan for sure if your group plan is average to mediocre. Okay. All right. Hope that helped. It's just difficult because I don't know everything about your plan. Okay, I have FEHB, UHC retiree. Am I better off in general with supplemental or Advantage? Oh boy. Well, that depends. It just really depends on how much you're paying for that, Tony, your monthly premium. I would say if you're paying, $250 a person or less, and you have, Fed Blue or you have GEHA or whoever, so it's $250 a month or less, then that's pretty good. That's pretty good rates. But we'll have people that are on FEHB that are paying $500-600 a month. That's terrible. And with those people, I encourage them to go ahead and get off, FEHB fully and just take traditional Medicare A and B and get a supplemental plan because it's just a much better value. So it depends on what you're paying. Now, what some FEHB people are doing is they will take A and B. And then they will enroll, they'll keep their FEHB, you got to pay the premium, but then they'll enroll into what's called an MA only plan. That's Medicare Advantage only. Because then your Fed Blue or GEHA, whoever you had, will coordinate benefits with the Advantage plan. And then when you do that, what happens is you get a credit back from Fed Blue or GEHA, $800 a year on your B. And then you get additional credit from the MA only plan because you're getting your meds through FEHB. They'll take some of that money and give that to you as well. So there's a lot of FEHB people that do that, and it's an annual decision. You don't have to worry about being stuck in that if you don't like it. You can always every year during Medicare open enrollment turn back to FEHB. Now, if you do get a supplemental plan, then you actually are coming out of FEHB permanently, and you actually have to sign a form saying so. because once you go with a supplemental plan, then what happens, you terminate your FHB benefits, and that money you're paying then will come back on your annuity. Because right now they're bringing those premiums out of your annuity. So you cancel it, annuity will increase, and then you're just like everyone else that's in traditional Medicare with a supplemental plan. And that's fine. So it really just boils down to, what does it cost you to be on FHB? Make that comparison, and if it's close, call in. And our agents will take the time to do a quick comparison to tell you what rates are in your market to see if that's going to make sense or not. And we'll be honest with you if it is. Okay? If we say, hey, you're setting well, we'll be honest with that with you and tell you. Okay, let's keep going. All righty. Marvin, I have Medicare Part A and B with Supplemental Plan G with Humana. With the government shutdown, will this affect my rate with my Supplemental Plan G? No, it won't. The only thing that really affects supplemental plans, folks, are the claims coming into that group. Because what happens in any supplemental plan, you're in a group. You bought a plan with the same company, that's a company, and other people who bought the same plan around the same time, same company. You're all in a group together. And so what's happening with that group is money goes in through your premiums, money goes out through claims. And what happens is, if more goes out in claims and is coming in through premiums, then that's going to cause there to be a premium increase. And that's going to happen with all of them. And so this whole government shutdown issue has nothing to do with that whatsoever. I promise you. It's only when claims exceed premiums are you then going to see a group increase for your plan. Now, some plans, some states, you'll see a slight annual increase just because of age. We call that attained age. So you may see an increase because of age of $50 for the whole year divided by 12, so it's $4 a month or something. So you have small increases because of age, and then the potential of a group increase. Okay? But government shutdown has nothing to do with that at all, just claims. All right, Daniel, let's keep going. I'm just about wore out here. Did you use your travel medical insurance because of your eye issue? How was the claim experience? If so, happy you recovered? Is that as serious a condition? Okay, very good. So Lot would not know what you're talking about, but my wife and I were on vacation going on our first river cruise ever down the Danube in Germany and a couple of countries. And we had a pre-trip in Prague, spent 3 days in Prague before actually going to our ship, boat. We get on the boat, and I was having some vision problems for a couple days, and then come to find out my retina detached. And so I went to the hospital emergency room. They told me what happened. Retina was detached and wanted to do an immediate operation. Problem was they put gas in there as part of the repair, and you can't fly for 4 weeks. And so we caught the first flight out of Germany we could. And we came back, and I had my eye surgery. All went well. I'm really, really doing well. I'm thankful. My macula was still on. When the macula is off and your retina detaches, that's even worse. Longer recovery and all that. But my macula was on. My retina had torn in 2 places, 1 o'clock and 4 o'clock. So when they put the gas in, I still didn't have to keep my head down all the time. I just had to stay sleeping on my right side. So anyways, long story. So about travel insurance. Well, number one, I did have travel medical insurance. What I didn't do, that I'm kicking myself, I didn't have travel interruption insurance. I've never bought that before, but I did have travel medical. So yes, it did cover me in Germany at the emergency room and all that. Now, when you get back to the States, then just my normal health insurance took over, but I did get to use the medical, but not travel interruption. So I'll never take a trip again without that. That trip, literally was $20,000 lost because, we got on the boat, but we never left. We were on the boat one night, anchored in Regensburg. But anyway, so I got no refund, nothing. It was terrible. But anyways, bigger trials in life for sure. Let's keep going. But thanks for asking. I'm doing great. Okay, very good. I guess we are done. We're going to have another one of these. So it's Monday night. So we have another event this coming Thursday. Daniel and I will be with you all 5 o'clock. We'd love to have you join in. Tell your friends about us if you don't mind. We'd sure appreciate that. And anything that we can do to help you, please reach out to us. We'll do our best to be a good broker to you if indeed you use our services. And remember, folks, there's no cost. You never have to pay the agent. We as agents are paid by the health insurance companies, not by you. And so we bring a lot to the table, lots of options and service, and we'd be delighted to serve as your Medicare broker. Let us know if we can help. Thanks again. Take care.